check, diver 1. Attendant, can you come up on the diver's umbilical, please? No comms, diver 1.
One call given, no response.
Can I jump to standby, please? No comms, diver 1.
Coming standby.
The standby diver on the left screen is ready to dive. The standby diver on the right isn't. Remember, serious brain damage can occur after 3 minutes without air, and it takes valuable minutes to get the diver back to the boat. A standby diver must be prepared to act swiftly to recover a diver in an emergency. In most locations in the world, standby divers are required to be present during occupational diving operations. Wherever possible, they need to be located on the surface and be dressed and equipped to enable immediate entry into the water with a minimum of delay. The standby diver must be practiced and experienced because the dive team depends on them.
Come on, get the standby in the water!
It does require this standby thinking that the person doing that role and their attendant are ready to go at any time, so that even though there's large amounts of boredom involved in sitting there being a standby diver, you're ready to go and do your best with a moment's notice, literally, if it's required. And that can only be achieved by preparation, planning and practice.
Good morning, fellas. Just to go over quickly what we're here for today. We've got some...
A standby diver needs to be well practiced in handling a diver rescue effectively and have a basic knowledge of the steps to be taken in treating a medical emergency. They need to have a thorough understanding of the risk assessment of the task and site. The right attitude is essential. A standby diver cannot have a gas load that would prevent them from recovering a diver at the team's working depth. Like all divers, the standby diver must be free of all drugs and alcohol.
Attendants, please. Are we fit to dive?
Fit to dive.
Okay, we're good to go.
They need to have a current diving medical certificate and a diver certificate of competency. They need a thorough understanding of rescue techniques and a working knowledge of the work task and equipment being used. A standby diver must be ready to go when needed. The standby diver's attendant needs to ensure that the standby diver is dressed safely, efficiently and checked before the dive begins. It is also important to consider the standby diver's welfare, making sure they're well hydrated, protected from sun exposure, heat and cold. Acting quickly can make the difference in saving someone's life, or not. Being fully prepared can be equally as important. Do a final visual check before entering the water. In a real rescue, you will need to act far more quickly than what is depicted in this video. It will need to become second nature. The standby diver should follow the diver's umbilical without pulling the line and maintain constant contact with the supervisor during the rescue. Upon reaching the victim, the rescuer should pause momentarily. They need to assess the situation and any hazards before proceeding further. Is the rescuer about to put themselves in the same danger? This needs to be assessed by the standby diver before taking further action. The standby diver needs to continually paint a visual picture for those on the surface. This should be clear and concise.
Helmet is dry. Diver 1 seems to be unconscious but some light breathing.
If the victim is conscious, the rescuer must assess the victim's mental state and then proceed in a manner that does not induce panic, increase the victim's pain, or complicate existing injuries and the rescue process. If the victim is unconscious, a series of precautionary measures must be carried out before the diver is recovered to the surface. The standby diver will need to check for a response. If the diver is unconscious, or there is suspicion of bad air, the diver's bailout supply will need to be turned on. This overrides the umbilical supply in case there is any problem with the air source. The supervisor should also switch to an alternate gas supply. Flushing the helmet refreshes the air, removing any excess carbon dioxide and reduces the potential for water ingress, creating a clean air environment. Purge the regulator in case there is any water trapped inside. The rescuer must assess the victim's state of buoyancy.
Securing rescue hook.
Roger that. Make sure he's clear of that hydraulic hose.
Hydraulic hose clear.
Having a rescue strop may make the recovery easier by allowing the standby diver to have their hands free. The standby should position themselves so they can access the diver's equipment while maintaining the diver's airway.
Tilting diver one's head back.
It is best to let the attendants control the ascent, especially in low visibility, as it's difficult for the rescue diver to judge the ascent rate in these conditions. The standby can assist the attendant using clear communications.
Up on both divers' umbilicals.
Unconscious diver, up on diver's slack. Both divers back to the boat.
Up on both umbilicals.
Attendants must limit unnecessary slack and prevent restrictions of the umbilical. They must actively listen to comms
Come tight on both divers, please.
Roger, up on both slacks.
and acknowledge any directions given by the dive supervisor. The surface team will be monitoring the ascent rate and will be providing guidance to the standby diver.
Coming up on slack.
Roger.
Flaring fins can be used to slow down the ascent if needed. If a BCD is worn, the standby may inflate the BCD or release the weight belt once on the surface to help retrieve the victim from the water. Every circumstance may require a different action.
Over the years, one of the greatest deficiencies I've seen in practical rescue is the physical handling of a person who's not able to help themselves out of the water onto safe ground, and that's often really, really difficult. So the best way to get an appreciation for that difficulty and work out whether you have adequate equipment, whether you need a stretcher, whether you need a slide or a sling or some assistance, and where to stand, how to do it, is actually just to do it yourself and practice. So that I don't think, need to be included in every standby drill, but it needs to be done for different venues, different dive platforms, different team configurations.
Divers at the back of the boat.
When at the recovery point, the standby diver should assist in accordance with the emergency management plan.
I need you to get the O2, please. Get the O2.
So let's take a look at the procedure again for the out-of-water standby diver, and let's assume it's you. Are you experienced enough to be the standby diver? Are you ready to go? Follow the umbilical to the diver. Assess the danger as you approach the diver. Clearly communicate all actions to the supervisor. Check to see if the diver is conscious or responsive. Ensure there is a supply of gas to the diver. Assess and adjust buoyancy. Position yourself for the recovery, maintaining the diver's airway. Once on the surface, inflate the BCD or release the weight belt. Assist with the recovery on the surface. Remember that your life or the life of your teammates may be dependent on the standby diver being alert and ready to go when needed. Practice these skills whenever you can in the workplace and record those practices in your diver's logbook.